In this video, you'll get a quick overview of Vibrant's Cardio-Zoomer test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest synergistic tests, and end by summarizing the key takeaways and where to go for additional information. Cardiovascular disease affects almost 128 million Americans. It is the #1 cause of morbidity and mortality in the United States. In fact, according to 2022 mortality data, heart disease and stroke currently claim more lives each year than cancer and chronic lower respiratory disease combined. And the economic cost is huge. The estimated direct and indirect cost of CVD was almost $418 billion in 2021. So how can we catch this condition earlier and prevent cardiac events in our patients? With better testing, of course. Testing like Vibrant's Cardio-Zoomer. The Cardio-Zoomer provides a comprehensive assessment of cardiovascular health by measuring both traditional and emerging biomarkers across key risk categories. This holistic approach delivers valuable insights for early intervention, prevention, and personalized care. How comprehensive is the Cardio-Zoomer? Very comprehensive. Just look at all the markers on this markers list. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that has all 3 combined as it is the most comprehensive. Let's start with a quick overview. The Cardio-Zoomer report includes a cover page, a table of contents, an introduction, questionnaire data, a summary with marker interpretation, educational infographics, and science-backed personalized recommendations, and then ends with a list of all the markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. The Cardio-Zoomer includes 6 categories listed on the table of contents: metabolic risk, redox risk, endothelial dysfunction, lipids, ceramides, and sterols, inflammation, and macrophage recruitment and plaque. However, the test begins with the Cardio-Zoomer summary, which includes 2 risk scores, the Reynolds risk score and the Framingham risk score. The Reynolds risk score and the Framingham risk score are effective tools for predicting the 10-year risk of cardiovascular events, considering demographics, biomarker status, behavior risks, health comorbidities, and family history to holistically assess an individual's risk, thereby increasing the predictive value for cardiovascular diseases. Below the risk score is a Cardio-Zoomer summary infographic, which gives a 30,000-foot overview of the patient's metabolic risk, redox risk, level of endothelial dysfunction, lipids, ceramides, sterols, and inflammation, along with macrophage recruitment and plaque formation. Markers that are out of range are listed in red when elevated and yellow when moderately elevated. In general, the more markers listed on this page, the higher the patient's risk. This infographic is instrumental in explaining risk and risk progression to patients. Now let's dive into each of the 6 categories, starting with metabolic risk. Testing for metabolic risk involves assessing for markers of glucose metabolism like hemoglobin A1C and glycated serum protein, also markers of insulin resistance like HOMA-IR and adiponectin, metabolic factors like leptin and TMAO, liver function markers like ALT, AST, and GGT, and renal function markers like BUN, creatinine, and uric acid. Testing for redox risk evaluates for oxidative stress, a critical factor in the development of cardiovascular disease. This includes 8-OHDG, a marker of DNA damage, 2 markers of lipid peroxidation, F2-isoprostane and malondialdehyde, and 2 markers of protein oxidation, nitrotyrosine and chlorotyrosine. The Cardio-Zoomer also includes 8 omega fatty acids, 5 omega-3s, EPA, DPA, DHA, total omega-3, and the omega-3 index, and 3 omega-6s, LA, AA, and total omega-3. In general, the omega-3s tend to be anti-inflammatory and omega-6s tend to be pro-inflammatory, so balancing the 2 is crucial for calming inflammation. Testing for endothelial dysfunction measures markers related to nitric oxide availability and vascular health. Nitric oxide helps arteries relax and be more flexible. Homoarginine, arginine, and citrulline are involved in nitric oxide biosynthesis, so low levels of those are associated with increased cardiovascular risk. Meanwhile, ADMA and SDMA are potent inhibitors of nitric oxide production, thus high levels serve as markers of endothelial dysfunction. Finally, the ratios provide additional insights into nitric oxide-related vascular health. The endothelial dysfunction section includes this wonderful infographic you can use to teach patients about nitric oxide-related vascular health, specifically showing how arginine and homoarginine promote nitric oxide production and vasodilation. Meanwhile, SDMA and ADMA inhibit nitric oxide production. Testing for lipids and ratios evaluates key lipid components that are crucial in cardiovascular disease risk assessment. This includes traditional cholesterol panel markers like HDL, LDL, and triglycerides, along with small dense LDL, Lp(a), and the lipoproteins ApoA1 and ApoB. The lipids and ratios section includes this infographic visually showing the different sizes of each particle, making it easier for patients to learn and remember that small dense LDL and oxidized LDL are the most likely to get into the artery wall and increase risk for atherosclerosis. Testing for ceramides and ratios focuses on lipid molecules involved in cell signaling, apoptosis, and inflammation. In general, elevated ceramides promote inflammation and endothelial dysfunction, which contributes to the development of atherosclerosis and cardiovascular disease. The sterol section includes 2 production markers, desmosterol and lathosterol, and 2 absorption markers, campisterol and beta-cytosterol. In general, you want to have low production and also low absorption. Looking at the graphs, the healthiest pattern is low production, so your body's not making very much cholesterol, and also low absorption, indicating you are removing cholesterol from your body via elimination. The inflammation section includes markers that reflect chronic inflammation, which is a key factor in cardiovascular disease. This panel includes hsCRP, a well-known marker of systemic inflammation that is linked to higher risk for heart disease, along with other markers such as homocysteine, interleukin-6, and TNF-alpha, which are involved in the inflammatory cascade that promotes vascular injury and atherosclerosis. Finally, NT-proBNP and cystatin C are both indicative of heart and kidney function, respectively, both of which are essential in cardiovascular risk assessment. Testing for macrophage recruitment and plaque formation assesses key markers involved in the inflammatory processes that drive atherosclerosis. This includes MPO, aka myeloperoxidase, which contributes to the recruitment of immune cells in the arterial wall where they promote plaque formation. Plaque, PLAC, is an enzyme that can assess the amount of inflammation in your arteries due to buildup of cholesterol. And oxidized LDL is a critical player in the inflammatory cascade that destabilizes plaques and contributes to atherosclerosis, leading to higher risk of cardiovascular events such as heart attack and stroke. Testing for clotting risk and cardiac stress evaluates markers related to thrombosis and myocardial injury. D-dimer is a marker of clot breakdown with elevated levels suggesting that clots have formed and are being degraded somewhere in the body. Doesn't pinpoint where, but it signals ongoing coagulation and fibrinolysis. Troponin T is a sensitive marker of myocardial injury and is commonly used to assess the likelihood of heart attack. Creatine kinase, CK, is released when muscle tissue, including cardiac muscle, is damaged, thus serving as an additional marker of heart stress and injury. These markers together provide a comprehensive assessment of clotting risk and cardiac function. Finally, the CardioZoomer summary ends with personalized suggestions based on patient results. Next, let's touch on the methodology. Vibrant Wellness uses microarray for leptin, Sandwich ELISA for TNF-alpha, mass spec for the oxidative stress markers, endothelial dysfunction markers, ceramides, and sterols, and the Roche Cobas platform for all the rest of the CardioZoomer markers. Next, let's review the collection instructions and questionnaire data. The CardioZoomer requires 5 blood tubes, which includes 2 SST tubes, 1 lithium heparin tube, 1 EDTA tube, and 1 sodium citrate tube, along with 1 urine tube. Thus, the CardioZoomer requires 2 sample types, serum, aka blood collected via venipuncture, and urine. Patients follow the blood and urine collection kit instructions provided with their test kit. The CardioZoomer also asks patients to complete a questionnaire. The questionnaire collects information about demographics, cardiac health symptoms, systemic symptoms, medical background, dietary patterns, and lifestyle. If the patient completes the questionnaire, the data is included in the final report for more customized clinical interpretation. Finally, let's talk about synergistic tests. But before we do, I'd like you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. Therefore, in addition to the CardioZoomer, consider the cardiogenetics test, which evaluates key genetic variants, i.e. SNPs, involved in cholesterol metabolism, blood pressure regulation, inflammation, blood clotting, and drug response, providing actionable precision medicine insights for personalized prevention, early intervention, and lifelong heart health. Also, the hormone zoomer to assess urinary hormone levels, metabolites, and endocrine disruptors to help identify root causes of fatigue, weight changes, mood shifts, and poor response to treatment. When combined with the CardioZoomer, it offers a complete picture of how hormone dynamics can affect cardiovascular risk, blood pressure, and metabolic health. Also consider the gut zoomer to investigate microbiome-related drivers of inflammation like LPS, opportunistic bacteria, and intestinal hyperpermeability. Or the food sensitivity test or food zoomers to investigate food-related drivers of inflammation. Or the total tox burden test to investigate heavy metal, environmental toxin, or mycotoxin exposure that's contributing to inflammation. Or any of our infections testing, including tick-borne diseases or the viral infections test to uncover pathogenic drivers of inflammation. And finally, the micronutrient panel or NutriPro to optimize nutrient and antioxidant status in your patients. In summary, Vibrant's CardioZoomer test measures real-time markers of heart health and reveals how cholesterol, inflammation, metabolism, and vascular function impact cardiovascular wellness, allowing you to catch cardiovascular-related issues earlier and help prevent life-altering cardiac events in your patients. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.